Okay, so we're going to show you how to do an Unna Boot. You want to put your patient up on the table or your chair, elevate them so it's easier for you not to have to bend down because it's going to kill your back, and it's easier for them to just let their leg hang. I always tell the patient, just let it hang, no help, no needed. All right, open that up. It's got a white paste on there. It's zinc oxide. It's a good healing agent. It is very stainful to your scrubs, so be careful to keep it away from you. It's a little messy, so glove up, sleeves up, take it out. So you're gonna start in your forefoot, right? You're gonna start right here. You're gonna wrap around. Do you know how to do your figure eight? All right, so you're gonna wrap around twice, and then you're gonna come on up around the ankle.
So you do the flip over.
And so I like to do my figure eight first and then do my flip over, right? Because they're most likely getting this put on them because they're swollen. So I do 2 wraps around. When I come here, I wrap it around the ankle or the lateral malleolus, wrap it around, bring it back down, and then I come up and you get that figure eight.
So you never wrap it around the heel?
Yeah, no, I wrap around the whole thing. So the whole thing is to do this compression from here all the way up. So I'll show you the beginning and we'll do a few of these. So you see how it's a paste? You're gonna just put it right here. So against the body, let's flip this bad boy over.
Cool.
Against the body, it is a cold, right? Wrap it up. Wrap it around that ankle. Come on down, wrap it up, right? Now you give it that compression where you fold and leave it nicely down. It's important that you keep it nice and clean because this hardens up. It's like a soft cast. So if it's ridges on here, it could actually break that skin. Go ahead, take over. And you'll do another one to start. And you're gonna roll under. And it's easier if you hold your roll like this or like that, whichever one helps you. And what you do is you do 25% coverage on here. So it's 25, 25, 25. Once you hit the lateral mal up, you're gonna do 50% coverage. So go ahead and fold that way towards you. Yep, just let it lay. Perfect. And keep it nice and tight, like that. Perfect. Go around, and you're gonna bring this up a little more like this. There you go.
And stretch up.
And then flip now this way. So if you keep the roll closer to you, that roll will actually bend right here in the middle. The goal is to have all your folds in the middle, right? So go around that ankle, the back of the heel, perfect, come up. Now fold it right there. So up a little and then break it down, there you go. And you can always manipulate it like that. In the beginning, it's gonna take you some time, right? We're not worried about speed, we're more worried. And before you bend it, you can always flatten this out, make it nice, right? Because it'll harden and it can break the skin, especially on our geriatric patients. Do it again, and you're gonna continue the same thing going up.
Afraid I'm gonna drop it.
I know. So right here is where you start your 50% coverage. So you're gonna move it up, and this is where you start covering right here. Boom.
Yeah. And you just do the wrap, you don't do the
And
flip?
nope, you're gonna keep doing the flip. The reasons for the flip is if there's so much edema, pitting edema, and it swells up, it allows that space to open up. If we just wrap it, we're not gonna let it open up, and it could actually cause some discomfort for the pain.
Okay.
There's some places that does where you can just wrap it all the way up, but I found that in the years that I've been practicing that it's easier that way. It's less pain, less discomfort from the patient. Bring it closer, bring that fold all the way up here. Keep pulling it that way. There you go. Yep. And go all the way down. Nope, all the way wrap around and fold. And you could go like this. Put your finger right here and fold. There you go. Wrap around, fold. So when you wrap around, come back up, roll it back up. When you wrap around, yep, roll it back up for you. There you go. When you wrap around, right, and you're gonna go this way, bring it at an angle because now you're gonna start doing that 50-50.
Okay.
And then you fold. So if you go like this, fold, hold, flatten, so it holds something, grab it, angle, fold, grab it, here, take it. Exactly. fold, under, grab it, angle it up this way. There you go. Now 50%, you see that?
Mm-hmm.
Now fold, under. And this is where you could tell the patient, I don't need you to help me, go ahead and rest your leg for me. Boom. Buys you more space, right? So you want to make sure that you have at least 2 to 3 fingers up from behind this bend, so it's easier for the patient, won't cause discomfort. So go ahead and fold it right there again.
Fold.
And then just hold it right here with the other hand. There you go. Now wrap that bad boy, and then you're going to continue to do the same thing, but you're going to start working your way down.
Okay.
So angle it down. There you go. And you keep it that 50% coverage. And then fold and continue the whole thing until your roll is done. Some people like to cut it off and toss it. I don't waste material, just use it. Good. Perfect. There you go.
You're still recording.
And then hold it from that side. It's tricky, but after a while, you'll see you'll be rolling so quick, it'll be like nothing.
Wait,
Keep going. No, you keep roll and then fold. And then you see it's done.
Mm-hmm.
Go ahead, take it off. On this part, I'll save the end towards like this. And then what you do is you flatten out all of the pieces and parts to make sure there's no ridges in your folds. Good. Now you're going to go ahead and grab your cling. And you're going to start from the bottom against the body. Flip against the body. There you go. So you're going to make sure the goal of this is to cover up all the white. So bring it up a little further. Boom. Right there. And then you can always look from under to say, make sure that you're covering those mets. Okay, roll it twice. You're gonna go up this way. Yep, up against the lateral mount, behind that heel. Bring it down this way. And keep it right there. You see that figure 8 you just created? That's your figure 8.
Okay, and then you just flip it.
And then do it again. All the way back up, lateral mount. And then do it around all the way up. And you don't have to pull it. Just let it naturally sit there.
Okay.
And then go all the way up. And the same thing with this is more like a 50-50 coverage on it. So the way you get that 50-50 is to angle up. So if you, instead of going straight this way, you angle up.
And you keep doing the angle.
And you keep doing it all the way up until you're done with it, and then you can grab another cling. Because what this does is make sure that that medication doesn't absorb outside of that. And then you have your other cling. And you start where you stopped. So right where you stopped. You could go right there, right there.
What I need to see.
So it doesn't have to be literal right on the step. You could have started from the top, but it's totally fine. But whichever way works.
And then work my way down.
Yep, so make sure you cover this up. And go do another one, right? There you go. And then wrap it around and then work your way back down. Beautiful. So now is your figure 8. Boom, down this way.
Gotcha.
Around the midfoot. Go back up, lateral mount. Cover that back of the heel. You see this little part right here?
Nothing else.
Of course. And then right there. We're recording as well, so if you're okay with that.
Okay.
Tuck it in, make it nice. Now, I always take off my gloves for this because you don't want to get zinc on your coban. This is the same thing. This is not as easy to manipulate, right? This is where, remember, C, coban compression. That's how you know what this does. C, coban compression. So you lay it down, you go around, and what you do with this is you pull and just let it lay. Okay? Pull and let it lay. And you try to do your figure eight to the best of your ability, right? Because coban is not the easiest thing to manipulate. So you can just pull and let it lay. And you're going to do another one all by yourself. And go around. And then you work your way up. So just pull and let it lay. And everything's always against the body.
So we're doing another figure eight?
You could work your way up right from there. No, you're doing good. So go behind that heel. And then you're going to pull and let it lay. And you can always, exactly. And then you start angling it up. Don't worry, we're always going to have ridges in a coban.
Okay.
So angle up. There you go. And pull. And there you go. Angle up. There you go.
Oh.
There you go. You're getting the angle because you want that 50% coverage. And the goal is to use one coban typically. If the leg is this thin, of course, we have some patients that are morbidly obese and we need to use more material, which is perfectly fine. Or if there's wounds and things like that. So on the end of a coban, there's always a little fold. You can unfold it and then have it stick because it's self-adhesive. Or you can cut it off, whichever one works for you. Depending on my day, I'll cut it or move. Perfect. What are the materials you used?
Unna Boot, which is it's called Eco.
The Eco Paste or Unna Boot, whichever one. What else?
C, compression coban.
What steps? Unna Boot first. What was the second thing you applied?
I forgot what it's called.
So it's called two things. It could be called Cling or it could be called Curlex.
Okay.
And that's that white thing that if you stretch it, it'll get even thinner. You don't want to stretch those. Those are easily. And then it's your coban.
Okay.
So it's Unna Boot,
Cling,
coban.
coban.
Yep. In that order. So, and it's always what? How do you roll it?
The figure eight, the 25.
And it's always what? Against the body. So that's how you know. When you grab something, it is always going to flow better when it's against the body. If you go like this, you're going to be rolling and feeling like it's all awkward. So that's what I mean by against the body.
Okay.
So the roll is always facing you and your roll's always up. So if you stretch this, you see how it thins out? You don't want to stretch that. You want to just leave it nice and soft.
Okay.
Okay? We'll let this dry so you can see how it is when you take it off, and we can do an Unna Boot on that side.
Okay.
So go ahead and grab your materials and do
You're
another
gonna
one.